what matters to us here at Fox 10 News, and we're always making sure that we're tackling those important health topics. We have one today. Hope Tindle is here to talk about a problem called fragility fractures. And thank you so much for stopping by.
Yeah, thanks for having me.
We were just chatting about this, and I said, is that something that we're seeing now? And you said, yes, absolutely.
Yeah, we have fragility fractures come to the clinic all the time. This is just a new program that we launched to prevent secondary fractures.
Yeah. And elaborate on that, because you were saying once before this wasn't something that was available.
Yeah, so we have the only traumatology department, academic center here, which is USA, and we work closely with traumatologists, and we are caring for hip fractures in the sense of an operative side, and then post-operative we're kind of doing this thing called secondary fracture prevention. So it's getting treatment and diagnosis and identifying the problem so we don't have to do a second hip fracture surgery. Yeah.
Now, in terms of identifying the problem, let's go back there. Explain, what is a fragility fracture?
A fragility fracture is a fracture without a high mechanism trauma, not a car accident, but a ground level fall. Somebody trips over an extension cord and then they have a fracture because of that.
And who's more susceptible to that? Is it the elderly, or is it unfair to pick on that age group?
No, it primarily is the elderly because, it's postmenopausal and it's men who, don't always get a correct number of vitamin D. Those types of population, but it can be anybody who has no mechanism of trauma and a fracture as a result of that.
Yeah, and you said vitamin D, and I read that is one way to help, even if you do take a stumble, if those vitamin D levels are good, that can perhaps offset some of the injuries.
Absolutely. We give most of our patients vitamin D who have a fracture to help aid in the quickness of recovery, and it's utilized all the time in our clinic.
And in terms of recovery, what is that time frame? I know that it's going to depend on the type of injury, but in general, how long?
So fractures, if they are seen acutely, right after injury, it takes a little while, close to 6, sometimes 12 weeks before we notice what's called callus, and that is the healing of the fracture, and that's what we see on x-ray when you come in the clinic, and then we start noticing, oh, they're not hurting as much, they're feeling better, they're kind of get back to activities. So it's a clinical and it's a diagnostic diagnosis. And
you also mentioned, as we were chatting before we came on out of the commercial break, about the importance of seeing a certified fracture liaison. Explain that, please.
This is a person who has dedicated time and purpose into becoming certified to identify and treat osteoporosis. And this is somebody who is in orthopedic clinic. Sometimes it's internal medicine. There's a wide range of fragility fracture specialists, but specifically in our clinic, it's orthopedics, and so we work closely with traumatologists, and that's kind of how we get our jump on that.
All right. Anything else you wanna add?
No, I think that's it. I just think it's important to be aware of what osteoporosis is and fracture prevention, and we want to help with that.
Thank you so much for stopping by.
Thank you so much.
Important information here.